there, Alan Dark. I'm going to be your nurse today. Today, it looks like, actually, you have been diagnosed with type 2 diabetes due to your sedentary lifestyle. That's for a different conversation, but this medication I want to educate you on is called Pioglitazone, and it is specifically meant to treat type 2 diabetes. I will teach you much more about it, but this is the medication that we're sending you home with, and here's some education on it. So you have type 2 diabetes, your pancreas is not creating enough insulin, and on top of that, you are insulin resistant is what type 2 diabetes is, Mr. Allen. So this medication here is to treat that specifically. That is the reason why we're giving you Pioglitazone. It is a medication that treats type 2 diabetes, in which you got for those reasons I just explained. And while we're at it, I'm going to give you the mechanism of action of this medication. So this medication needs insulin to be effective, essentially, right? So it's going to essentially help create the insulin be more effective in the body. This medication causes the body to be more effective in using glucose, and it reduces glucose production in the liver by lowering insulin resistance. Now, as far as taking the medication, you can take it with or without food. To kind of help the medication out, you're going to want to eat a healthy diet, which we can educate you on with the nutritionist, and I can give you a handout for that. But you're gonna want to eat a healthy diet while taking this medication. Again, you can eat with it, you can not eat with it, whatever you want to do. But again, good diet, exercise along with that medication is going to go a long way. All right, so while taking this medication, you're going to, when you do get labs, we're going to be looking out for hepatic toxicity, which is just, toxicity of the liver. Liver enzymes, ALT, AST can be elevated. As far as your blood glucose is something you can check yourself, but obviously expect for that to drop because that is the goal. We also we'll be doing a CBC on you. You can experience anemia. This is a bit more on the rare side of things that I'm listing off here, but these are possibilities. This medication can also cause weight gain. So again, along with this, just try your best to eat healthy, exercise, but this is something that can occur. So reasons why you would want to call your provider while taking this medication, if you have like a severe allergic reaction, right? Especially in the face, you can have itching face, tongue, especially around the mouth. Shortness of breath is something you can experience as well. These are things you're going to want to call your provider for. On top of that, you can have some kind of visual disturbances, vision changes. So if that's occurring, make the call to your provider. So if you're feeling super shortness of breath, you're having swelling of your extremities, you have weight gain that's abnormal and it seems to be kind of quick, make that phone call just because these are signs of heart failure. So with those things occurring, you're definitely going to want to call your provider. But you really shouldn't be feeling super fatigued. Again, feeling fatigue is another sign of heart failure, but it is something else that can be occurring and not mean heart failure necessarily. But if you're feeling any one of those symptoms, make sure to call your provider just to be safe. Oh, one more thing. As far as taking the medication, you can take it once daily is what I'm seeing. Looking at your chart seems to be the most common answer here. In our book and also in our in micromedics. That's all. But anyway, one time. But you're gonna want to follow the orders that your doctor gives you. So we're gonna go based off of that. But yeah, as far as frequency goes, taking the medication, we're gonna go mainly based off of what the orders are. And actually, more specifically, it looks like just starting this medication, we're gonna start you off at about 15 to 30 milligrams one time daily. But again, we'll go based off your chart, but it looks like 15 to 30 milligrams daily is the dose we're going for here. But Mr. Dark, this is your medication that you will be taking home with you. If you have any questions, concerns, especially adverse reactions, you're going to want to give us a call. But again, if you have any questions, don't hesitate to call us. We will be here for you, and you have a good day.